Hi, I'm Bob Kinzel, a senior reporter at VPR. We hope you enjoyed that fascinating episode of Nova. Now we want to hear from you. We've gathered an incredible panel of guests to talk about the legalization of cannabis in Vermont. With us tonight are Dr. Mark Levine, who is Vermont's health commissioner. He's also a member of the Public Health Subcommittee of the Cannabis Control Board. Also with us, Moortown Representative Maxine Grad, who is also the chairperson of the House Judiciary Committee, and James Pepper, who is the chairperson of the Vermont Cannabis Control Board. Thank you all for joining us tonight. We really appreciate it.
Thank you, Bob.
Now, viewers, if you have any questions or comments, please type them in the chat box on the right side of your screen. And please don't forget to include your name and where you live. Once again, if you've got a question or a comment, we'd love to hear from you tonight. Great opportunity with our guests. Please type your thoughts in the chat box on the right side of your screen. So let's start off tonight with James Pepper. Chairman Pepper, would you briefly tell us some of the major reasons why you think it's a good idea to legalize cannabis at this time in Vermont? Why are we going down this road?
Sure. Thank you for the question. I've always been a proponent of legalizing cannabis for a number of reasons. I mean, my primary concern was a consumer protection angle. We received, when I was working for the former governor, a report from RAND that suggested that about a quarter of Vermont adults use cannabis regularly, which they define as within the past 30 days. And this cannabis, comes from people's basements. It comes from people's garages. It's grown in an unregulated way. And to me, I didn't know any other product that's out there that people use with such regularity that doesn't sort of minimum testing or regulatory standards. So to me, it started with that. However, as I started to kind of shift my roles and became when I worked for the Department of State's attorneys and sheriffs, you see the kind of second and third order impacts that criminal convictions have on people throughout their lives, on their educational opportunities, on their employment opportunities. And you realize that, said that cannabis is a gateway drug, but what we found through kind of the decades-long war on drugs is that cannabis convictions are often the gateway convictions that get you entrapped in the criminal justice system for the rest of your life. And so for me, this became both kind of a social equity issue, and it also was a consumer protection issue. And so I think now, that we've learned some of the lessons from Colorado and Washington, and now that our neighboring states of Massachusetts and now New York have legalized cannabis, and Maine as well, we're kind of an island out there. And I think that it's time for us to kind of move forward with a more rational system.
Do you envision that we're going to have a situation where there's a Vermont brand of cannabis, much like the small craft beer market? Are we going to see that develop, do you think, with cannabis?
I really hope so. I mean, what's funny that you say that is there actually kind of already is. I mean, one thing that I've heard a lot over the years and now as chair of the Cannabis Board, I've seen firsthand is that we have some of the best cultivators in the state, in the nation, here in Vermont, right here in Vermont. They're growing for the legacy market or the illicit market, but they are some of the best. And if we give them a kind of welcoming regulatory environment to bring them out of the shadows and provide some of that consumer protection safety standards, I think we absolutely will be kind of a leader and in Vermont and in the country.
Representative Grad, through your leadership as the chairperson of the House Judiciary Committee, you've spent many hours working on this issue. And during the legislative debate over this bill, a number of lawmakers raised concerns about people driving when they're impaired by cannabis. As I understand it, there are no tests like a blood alcohol test to accurately measure someone's THC level. So if that's the case, how will law enforcement officials be able to determine when a driver is impaired due to cannabis?
Right. Thank you, Bob, for that question. So we have what are called DREs, drug recognition experts, and we have had them for years before legalization. And they have very extensive training to determine not only if a person is impaired, but by what substance are they impaired by. And it is important to look at impairment because some of the other tests, saliva tests and other things that have been discussed, look at presence, but not impairment. And that's really where cannabis is different than alcohol, for example. So I think the drug recognition experts, we also made sure that all law enforcement officers had what's called ARAD training, which is another type of training, again, to look for drugs. So, and my understanding is that we're in good shape. We have anywhere from about 45 to 55 or so DREs in the state. And so I think we're set, and prepared.
Do you think that's going to be enough DREs for the entire state? I mean, what happens if somebody gets pulled over and the nearest DRE is an hour away?
Right. Well, that we'll have to see. Right now, and perhaps Mr. Pepper can answer, but my understanding is that right now it does seem that we have good geographic distribution of our DREs. I believe the General Assembly will be getting a report from the Cannabis Control Board regarding DREs and distribution, but I'll defer to Mr. Pepper if he has anything else to add to that.
Yeah, so this is obviously an area of primary importance. We don't want to see any increase in highway incidents as a result of legalization. And I think Representative Grad is exactly right. We have a very good distribution of drug recognition experts around the state. There are some gaps in our coverage in the Northeast Kingdom and in parts of Windham County. But for the most part, the average response time is sufficient to get to the scene and do the evaluation at very close time of operation. And, one thing that the legislature required, I think back in 2016, is that moving forward, every officer that graduates from the academy is trained in ARIDE, which is the Advanced Roadside Impairment Detection Enforcement. And that is a 16-hour course that allows a trooper who's conducted a traffic stop to determine if someone is impaired. And then once that determination is made, that trooper can either call the DRE or can, in certain instances, call a judge to get a warrant for some further testing.
And Representative Grad, do you envision a time, is it a matter of 3 to 5 years when there will be an accurate test, or is that something that we just have to proceed without that being in place?
I think we do have to proceed without that being in place, and I think the DREs are an excellent way to do that. And time will tell if a test is developed, but it's again, cannabis, as we saw in the film, is a very complex plant, and it's not the same as measuring blood alcohol, BAC of alcohol.
Dr. Levine, as we heard in that Nova special, there are concerns about the overuse of cannabis among young people because the teenage brain is still in the process of being developed. What steps do you think need to be taken to reinforce this message to younger Vermonters in the coming months?
Thanks for that question, Bob. Just to provide a little more background to what you just said, when we look at our data from the health department, clearly Vermonters who are age 12 and above, the percentage of them who say they have used cannabis in the past month is significantly higher than that in other states and across the nation. And equally importantly, their perception of the risk of that use is quite low. When we look at the young adult age, 18 to 25, again, that's our highest risk age group in terms of highest use of cannabis in adolescents and young adults. And I need to emphasize, as you set me up to do nicely, that the brain is still developing through age 25. So we're particularly concerned about adolescent and young adult use. And we find that Vermonters who do use cannabis of any age tend to use it frequently. So that's a concern because the frequency of use has a direct correlation for the younger Vermonters with their opportunity to get into trouble. And by trouble, I don't mean with the law, I mean with their own learning and other types of impairment. So that's a very significant issue. When we look at prevention, though, at the level of public health, we try not to isolate out cannabis and say, oh, it's not as risky as something else, or it's really bad, or offer any value judgment. We try to be very consistent when we talk about substance misuse. And in fact, that's why what used to be called the Opioid Coordinating Council, which was developed quite a number of years ago, has transitioned to being the Substance Misuse Prevention Council. And the substances can be nicotine, alcohol, heroin, or cannabis. The strategies from a public health standpoint are all the same. And it really takes a very large educational effort, both for parents as well as for youth.
So you mentioned the other drugs involved, tobacco, alcohol. A lot of public health officials are concerned about the overuse of alcohol on the teenage brain and what happens there, a lot of similarities. Do you see some efforts that have been done in the education and prevention areas in terms of alcohol that might serve as a model for cannabis?
Actually, yes, but again, I'd had to isolate out alcohol because it's really a consistent message across nicotine, opioids, alcohol, cannabis. And it's really well illustrated in what we call some of our regional prevention networks that are all across the state that really take prevention from both a school curriculum-based approach, but also to a community-based approach. And all of these programs really try to enhance the empowerment of youth to make appropriate decisions, whether it be about drug use or some other aspect of their lives. It involves curriculum in schools. It involves substance abuse professionals across the state in a nice ratio of professionals to students so that there's equity across the state for having trained personnel who can work with students and who are trusted by them. We have the council that I just mentioned and a lot of prevention coalitions. And really the education for alcohol, again, is not isolated out as the example. It's really kids' brains, kids' decision-making, the impact of any substance that's potentially addictive on their brain chemistry. And then furthering that along on their ability to learn, on their judgment, on their ability to be attentive and concentrate. And then further in life, their ability to succeed, with employment, with being financially stable, not having criminal records, things of that sort, because all of these associations can be very positive when people are responsibly using other substances, as opposed to when things get carried away.
Tonight, viewers, if you've got questions or comments, please type them in the chat box on the right side of your screen. Please don't forget your name and where you live. Great opportunity to talk to our panel of experts tonight. Once again, please type your thoughts in the chat box on the right side of your screen. Let's start off. We have a question from Susan. James Pepper, I think you might be the best person to answer this question. How can Vermont avoid the takeover of big business from invading Vermont and driving out small Vermont farmers? This has been a big problem in California. We need to be ahead of this issue. James Pepper, how would you answer that?
Well, there's certain things that the board can do for sure. And there's certain things that the legislature can do and has done on this. One thing, very notable thing that is, I think, first of its kind piece of legislation in Act 164, our enabling legislation, was the legislature limited the amount of licenses a single entity could hold to one. And so while a single entity could have a cultivation license and a retail license and a product manufacturing license, they're not allowed to have multiple of each. So you're not going to see franchises. You're not going to see, RJ Reynolds come in with 5 different retail locations. So that's an important piece of this. Another thing that the board can do is limit canopy size. I mean, essentially the grow capacity for these facilities. Massachusetts, allows up to 100,000 square feet of canopy. That's, that can be a profitable business for a large company, but it's inaccessible to most Vermonters, the amount of startup capital that's needed. So what we're doing as a board is we're finding ways to really prioritize small cultivators and have low barriers to entry for those, the legacy market, the people that are currently growing for the illicit market, and trying to create a welcoming regulatory environment. Another thing that the legislature did was they said, you Cannabis Board need to create all sorts of regulations around security, transportation, enforcement, every aspect of the industry. But you can make certain accommodations for small cultivators in order to decrease the barriers to entry for them into this market. And we're not necessarily allowed to do that for any of the larger players. So there will be an increased compliance and enforcement cost for larger corporations that are trying to move into Vermont as compared to the smaller cultivators.
I think people hear numbers like 50,000 square feet of canopy or 100,000 square feet. And if they're like me, I really have a hard time getting my arms around that. And I heard you talking about this at a recent Cannabis Control Board meeting. So I decided to do a little research and said, well, how many square feet are in a football field? And it turns out that it's about 50,000. So, I mean, that's something I can get my arms around. So what you're really saying is that 30,000 square feet of canopy, it's about 2/3 of the size of a football field. Do I have that right?
That sounds about right. And we actually don't have a license type for 30,000 square feet. We created one kind of larger license type for outdoor cultivation because we really want to encourage outdoor cultivation. And we made it kind of just shy of an acre, just thinking about kind of Act 250 and the implications of other regulatory bodies coming in to regulate this. And so we did create one somewhat large license type for outdoor cultivation, but I think we maxed out our indoor cultivation at 25,000, 20,000. And essentially what we decided as a board is we're not even going to open that license type unless it's necessary. We have a target number of square feet of canopy that we're trying to shoot for in order to supply the demand that Vermonters and our neighboring states and our tourists are going to need, so we don't have supply shortages. And it's roughly 450,000 square feet. And so our goal is to open up the smaller license types first and see how much of that 450,000 square feet we can fulfill using small cultivators. And if we need larger canopy sizes because we're not, approaching that number, then we'll open up those larger tiers.
We have another question from Laura and Dr. Levine. This might be best placed to you. What's the plan for providing local communities with resources for prevention and public safety? Is there a clear idea of what communities might face with cannabis businesses in their communities? Maybe let's look at the prevention side of it. Is there a plan in place to help local communities, or will there be a plan in place?
So I think what the question is asking is really twofold. One is just prevention writ large, and the other is actually how does the community, if I could use the word, protect its youth? Because I think that's everyone's biggest concern when you're legalizing a substance of this sort, that we make sure that the audience we don't want to get their hands on it or get into trouble with it is protected. So education is wonderful, and that's important for protection, but the board is already looking at a whole host of factors that really cross-cut communities and just get at prevention of youth acquisition of the product in general, or misuse of the product in general. So some of that has to do with proximity to schools. Some of that has to do with where the substance can be used or not used in terms of in public places or not. Some of that has to do with advertising. And is there a billboard prominent somewhere? You know, God forbid in Vermont, but that kind of logic. And that, you know, the legislature, with the help of the health department in our initial look at this, really tried to focus on a lot of these things. Right now in this public health subcommittee that you've heard I'm on, we're very focused on product warning labels and making sure those labels are noticeable, making sure that they're pretty universally understood and don't take a lot of deciphering to figure out what do they mean here. And then not just the symbol, but the label that goes with it. And what does the label say? Does it have the appropriate content so that people understand that this product is not for pregnant women? This product is not for adolescents or children. Are there tamper-proof kind of ways to package the product? Again, we're talking about a product here that comes in many forms. Some of them are smokable, some of them are edible, etc. Some are dabbable. But the bottom line is you need to think each product through and make sure it has the appropriate protections surrounding it. So I don't know if I've been expansive enough for the intent of the viewer's question, but I want to de-emphasize one community versus another and emphasize how, as a society, we're trying to make sure that we've built in the right protections while still making the product available, obviously.
Representative Grad, over the years, we know that hundreds, if not thousands of people have been found guilty of possessing small amounts of cannabis. Some of these folks went to jail, others ended up with criminal records. So what happens now? Are there still people in jail for the possession of cannabis? How is this whole issue going to be dealt with?
I can't answer whether or not anybody is in fact still in jail, but I will say one of the things that the legislature did do when we passed legalization was that we put in place automatic expungement of criminal records for those who were have criminal records based on possession of cannabis. And I believe we have expunged already 12,000 records, 12,000 Vermonters records. So that's a lot of people. And the court is continuing to work on these automatic expungements. So it's very, very important. And I have to note that that the BIPOC community has been disproportionately impacted by the war on cannabis. It's based on racist policy, failed policy. And so that's one of the reasons that I was so supportive of legalization, to stop the arrest, stop the collateral consequences of criminal records. And I look forward to working with the board as they also address social and racial equity issues.
So as we go off into the future, Representative Grad, will there be additional efforts for people to have their records expunged?
Absolutely. Yeah.
So it wasn't a one-time, you got to do it this week or whatever.
No.
Let's see. Dr. Levine, we have this question. I think we might best start with you. This is from Patricia in Essex. How will Vermont handle the lack of mental health services when there's already a shortage for other substance abuse issues? What kind of public education efforts will be available for parents? Have you seen any statistics coming out from Colorado after they legalized it, such as higher rates of high school truancy? Let's back it up to the whole mental health services issue and what kind of public education efforts will be available for parents. How do you see that unfolding?
You know, we do have nationwide a mental health crisis, and certainly we share in that in Vermont. People may be surprised to hear, though, that we actually have some of the best access to mental health services in Vermont compared to almost all other states. So even though we often bemoan the situation, and it's, I think, highlighted by reports of people boarding in emergency rooms because they can't find a hospital bed, et cetera. That's really the crisis aspect of mental health care that all states are now suffering through. But in Vermont, we do have good access to substance use disorder treatment. So when you talk about where that treatment occurs, much of it is in an outpatient setting, and that's the ideal. For those who need to sort of be removed from their environment and go to another place where they can focus on substance use, we do have residential facilities, and they have access in Vermont on any given day. And then, of course, we have a whole bunch of community partners that we rely on intently to deliver specific substance use disorder treatment depending on what the substance is and what the person's needs are. So I would hate for people to leave this conversation thinking that someone who recognizes they have a substance use disorder and is seeking help for it is waiting on a list somewhere and never going to be seen and have a bad outcome because of that. Because I do think we have pretty good access in the state for that. So just keep that in mind. Cannabis use disorder is a true disorder. I think we often look at cannabis in the hierarchy of drugs or substances and think that it's much better than all the rest and it's much safer than all the rest, and you can't get into much trouble with it if you just don't overuse it at any given time frame and don't drive after using it. But the reality is there's a rate of about 9 or 10% of users who will develop a cannabis use disorder. It's still a substance like anything else. And even if that may be a lower rate than for some other substances, it's still real for the person who's involved. Detecting it and understanding it are different problems. And it is sometimes hard to tease out understanding if a person's situation is related to overuse of something like cannabis or not. But we have enough professionals in the state that I really don't think users who get into trouble are going to be suffering because they can't access the appropriate treatment. I will say that not to overly focus on the negative aspects, but there are clearly impacts on not only youth, but individuals of any age of using any substance. And so obviously we want the substance to be used responsibly. And when James Pepper was talking earlier about one of his goals in leading this board and in making sure that there was a substance that was legalized that had parameters it had to follow, it had a truth in packaging, if you will. You weren't just using something off the street that you had no idea what was really in it or how potent it was. One of the clear advantages of a legalized system is you can understand as the consumer what you are getting. And hopefully that would allow the kind of responsible use that wouldn't lead to any kind of downstream effects that would be severe. So I certainly understand where he's coming from with that, absolutely.
We got this from Laura in Bellows Falls, and James Pepper, I think it's best directed to you. What is the Cannabis Control Board going to do to make sure and hold commercial cannabis retailers accountable from making medical claims about their products? What can the role of communities and town leaders be in ensuring accurate information gets out about medical versus commercial benefits in Vermont? James Pepper, we already have some medical dispensaries operating in the state. We've had that law in place, medicinal marijuana for some time. Is the Cannabis Control Board going to be watching and seeing how different retailers market their products and some claims that they might be making?
The answer is absolutely. The Cannabis Control Board was charged with approving all advertising for cannabis and cannabis products. in the state. And we've been given some basic parameters further from the legislature about how to craft our rules around advertising. And first and foremost is nothing deceptive or misleading, nothing that represents the therapeutic effects of cannabis. And we, as Dr. Levine mentioned earlier, are working hand in hand with the Department of Health to develop the appropriate health warnings and also a point of sale flyer. So an informational flyer that is handed out at the time of sale, at the point of sale, that can have a lot more information than you can fit on kind of a small package. And we would approve that. And we're working with the Department of Health to develop the language there. So we are, of course, very much attuned to that aspect of it. I would just want to, if you don't mind, jump back to Patricia's question and just add one more point that Dr. Levine left out, or, I think the question really also touched on, is there capacity and resources in the system to deal with any sort of potential increases? And I would just say that Act 164 dedicated 30% of the excise tax of cannabis sales to the Department of Health to create substance misuse prevention programming. And so there is a dedicated funding stream to the Department of Health, which did not exist prior to this. And, we're looking at potentially, our consultants have given us some rough estimates of what the market size might be. And, they're estimating somewhere in the realm of $200 to $250 million in sales annually. So I think there will be a sufficient revenue stream. And then in addition to that, the legislature dedicated 6%, the entirety of the sales tax, 6% to after school programming. And, what we've seen and what we've heard is that, those hours when kids are kind of leaving school, but, their parents haven't come home from work quite yet, are the most risky times where kids engage in this risk-seeking behavior. And currently our after school programs only can supply 50% of the demand of kids for any number of reasons around Vermont. So that 6% sales tax dedicated to after school could be an important missing piece of this puzzle for youth prevention as well.
James Pepper, you mentioned different taxes. There's a 14% state excise tax. There's a 6% state sales tax. Local communities can add 1 or 2%, I think, on their own.
If a municipality has an approved local option tax, they can add that on to the sale. That's right.
So what do you say to those folks who say a 22% tax on this product? People are not going to be encouraged to go to retail markets to buy these products. They're going to stay with the underground market.
Well, a lot of our market demand is going to be driven by tourists. One way or another, we have roughly 400,000 over 21-year-old adults in Vermont. We have home grow. So, there's not a lot of those folks that don't know where to kind of find cannabis when they need it from their friends or themselves. And we have between 13 and 16 million tourists a year. And those are folks that really want to know what they're purchasing, want to know the cannabinoid profile. They want to know that a product's been tested, and they want to purchase it from a store. And I think they're willing to pay a little bit of a premium to come to Vermont, just like they do with our craft beer and our craft maple syrup and cheese, and pay a little bit extra for a specialty product here in Vermont. And so I'm not as worried. I know that there's always a balancing between the illicit market prices and the regulated market prices. And usually the illicit market can always undercut, no matter what the price is, of the regulated market. But I think that, the benefits of a regulated market will drive at least a lot of our tourists to retail outlets.
Representative Grad, we got this question from Heidi, actually writing us from California, a legal question. Here in California, people who use weed feel they have the right to do it in any public or private space. What will you do to prevent this? Does the Vermont law address using cannabis in a public space?
It does, and it prohibits it. Yes.
And in private places, it would be certainly acceptable?
Well, I'm not sure what Heidi means by private places. Are we private homes, private clubs? Somebody's home, it's acceptable. So not really sure about exactly what the question is going to, but there are certainly parameters around public places, and we don't have lounges like other states do. Perhaps that is what she might be getting towards.
Well, let's look at the idea of defining public. How about City Hall Park in Burlington? How about walking on the bike path along Lake Champlain, an outdoor park somewhere, taking a hike up Mount Mansfield? Are those all public places?
I would say yes. I would say yes.
Dr. Levine, we got this question from Jesselyn Dolan, who is president of the American Nurses Association in Vermont, who wants to know, have you or do you advocate for medical professionals to educate themselves, recognizing that most medical professionals have little to no education on cannabis?
That's a great question, because one would have said the same thing about opioids literally 2 years ago. Clinicians have been prescribing opioids for a long, long time. Yet at the same time, we've now, because of the opioid crisis, renewed efforts more and more every year to make sure that medical school curricula contain the appropriate needs, and that postgraduate training also include that. And even continuing medical education, there are now requirements surrounding treatment of pain for opioids, et cetera. So when you come to something like cannabis, you're absolutely right. It is a drug that has suffered in many ways. First of all, it suffered from its maybe not absence, but not clear emphasis in medical curriculum. Number two, because of the federal laws, it suffered in terms of research base. So when one wants to educate, you need to have a solid foundation of knowledge. And to have that solid foundation of knowledge, we have things you can learn in books, but then things you can only learn with important research. And research has been hindered quite substantially. And I think the film everyone just watched gave a glimpse into that and into how some clinicians are trying to make up for that real time now, just showing how much work we still have to do. So I think that the whole topic of substance misuse and the tragedy in our country of the so-called deaths of despair, which usually involve alcohol, opioids, liver disease, suicide, all of that together is now catalyzing the kind of educational effort that the questioner is asking about. So I'm much more comfortable, and having participated in curriculum development at the University of Vermont College of Medicine, I'm much more comfortable with the aspect of focus that's going into these important areas. It is late, but it's never too late.
We got a great question from Al in South Burlington for James Pepper. Chairman Pepper, lack of access to traditional banking and lending is a major issue in the cannabis industry. Inability to raise up a startup capital puts the cannabis industry out of reach for most. Does the state intend to address this problem? So let's look at it maybe in its most basic model, which is cannabis is legal in Vermont, but it is still illegal as a federal drug, James Pepper. So how do banks get involved, or do they not get involved? How does all the financing work?
This is an incredibly complex area of the regulations that we're trying to grapple with. There are FinCEN guidance and Banking Secrecy Act guidance that that banks can look at. I mean, and when I say banks, I think the kind of National Banking Association has discouraged federally insured banks from participating in the cannabis industry or banking with cannabis businesses. However, we have some state chartered credit unions, notably VSECU, that has been banking cannabis money since I think at least 2013, when we started our medical program. I've been working pretty closely with our partners at the Department of Financial Regulation to work on our application requirements to see what sort of information that we need, that we can solicit from our applicants that we can then share with financial institutions to give them the confidence that they need in order to bank with these folks. I can tell you that there's a lot of bankers that are curious about cannabis. I think a lot of them are cautious, rightly so, about doing this, and that their compliance costs, which they pass on to their customers, is quite high. So this is a very difficult problem to deal with. Our consultants, who are mostly made up of regulators from other states, Colorado, Massachusetts, have advised us that there are out-of-state, Massachusetts-based, for instance, credit unions that will be willing to bank this money in Vermont. But again, the cost of compliance is still going to be passed on to the customer. So that's a piece of this where we're still trying to figure out what exactly that costs are going to be and try and balance out some of the other regulatory costs so that this business isn't dominated by people that can afford to participate, only people that can afford to participate.
And James Pepper, I think when Colorado started, it was a cash business everywhere. They didn't have state chartered banks to help them out. That's probably something you would like to avoid.
So it was largely a cash business initially in Colorado. Now they have roughly 90% of their cannabis establishments have bank accounts.
Representative Grad, you talked earlier in the broadcast about the importance of having social equity provisions in the law. Could you speak to that and what you feel is important?
Right, thank you. Well, it's important to try to repair and mitigate the harm that the war on cannabis has caused to communities of color. And I thought the film did an excellent job of demonstrating that. And for instance, and this is an issue in Vermont. The Council of State Governments, they found in fiscal year 2019 that Black people were disproportionately incarcerated for drug offenses. ACLU found in a 2018 report that was right before legalization went into effect, that Black people were 6 times more likely to be arrested for cannabis than white people. So, so I am really hoping that that the legalization, the board's work, the expungements really help start to mitigate and repair the wrongs that that our fellow Vermonters have suffered.
And James Pepper, in the law, it says, quote, that the board should develop policies to ensure that people who were disadvantaged by the years of the criminalization of cannabis are given opportunities to participate in this new retail marketplace. How will that work?
So the board actually just voted on what we're calling our social equity criteria. And most states now have grafted on a social equity program to their cannabis because this has become a central focus point of a lot of cannabis programs around the country. So we defined our social equity criteria on at our meeting last Friday, and essentially it's if you're a person of color or if you have a cannabis related offense, and that's it, period. If you fall into one of those 2 categories, you will be considered a social equity applicant in Vermont. And that comes with certain benefits. There's a community development fund that's set aside for social equity applicants to access. And it's kind of a revolving loan fund that is funded through the legislature, through the general fund, and with the contribution from our current medical dispensaries. So there's that. We, of course, will offer reduced or waived fees in the early years of starting a business for social equity applicants. We'll also have priority review and expedited review. So if we get an application from a social equity applicant, it'll get moved to the top of the pile of our review. And there's also a kind of technical and business management and support program that's being developed through the Agency of Commerce to help social equity applicants with their application process and with their ongoing kind of business needs. So there will be, though the exact benefits are yet to be defined. I think that's kind of where a lot of other states have landed. And, I think other than the criteria, the board next has to turn to what those specific benefits and privileges are going to be.
Dr. Levine, we got this from Mariah in Essex Junction. I work in the substance misuse prevention field in public health, and my experience has been that the public perception of cannabis has not yet caught up with what we've learned from research in the last decade. I'm concerned that at the same time the media and the industry has been normalizing the use, the actual harms are increasing with increased potency. And what efforts are going to be made to support public education before the products start hitting the shelves? Dr. Levine?
Those are a great set of questions. The reality is, like any industry, the industry is going to advocate for its product, and that's fine. They can provide true information, but there's a potential for people, just like with the COVID pandemic, to get caught up in misinformation as well. There is plenty available at the level of the internet that would tout benefits that really have not been researched and are non-existent. Potentially benefits that, if you accepted what they said at face value, could create harm. And the one I'm thinking of the most is the pregnant woman. It's been quite nationwide an epidemic of recommending that pregnant women who suffer from a variety of maladies in their first trimester, not the least of which can be nausea and vomiting, to try to improve upon that by use of cannabis. But the reality is cannabis has some very significant impacts on fetal development and on the weight of the fetus at birth, etc. So if one only believed what they read on the internet, they would be actually following a poor course. I'm not saying anything bad about dispensaries in the state of Vermont, but I believe the Cannabis Question film called out a little bit about misinformation that could come at the level of a dispensary as well, because they are indeed selling products. And they did call out the fact that not everyone is a fully trained professional who's offering advice in those settings. So there's plenty of opportunity for that kind of misinformation to be dispensed, if you will, to the population. But clearly, we can try to compensate with education, and we indeed do that. At the level of youth, we do a lot of that at the school setting. At the level of parents, I would draw people's attention to our own website, which has a section called Let's Talk Cannabis, which really does focus on parental needs as much as anyone else. And we have a lot of reports, such as a health impact assessment that informed what the legislature actually came to do, and a report from the Education and Prevention Committee of the original Marijuana Commission, which also provide a lot of education. So I think, the only way to combat misinformation is to call it out when it's present, make sure that it's corrected, and make sure that people have accurate resources to obtain information from.
James Pepper, I wanted to bring the last question to you. We're talking about having retail marketplace in Vermont a year from right now, the fall of 2022. Let's think about what has to happen between now and then. You need to have licensed growers, and you're favoring small growers. You need to have product manufacturers. You need to have testing labs for all of these products. You need to have wholesalers, and you need the retail stores to be in place in 12 months. Are you going to make it?
Well, I think most people that have been paying attention to this issue know about our kind of rocky start. You know, a lot of the bill passed during the pandemic, which, you know, baked in a few delays in the appointment process. And, you know, the short answer to your question is the board has a plan to get our rules in place and our fees in place on time to meet these deadlines. But there's a big caveat there, which is that a lot of forces outside of our control need to also kind of tip in our favor in order to do that. I mean, you know, just from a rulemaking perspective, we need to have the I mean, I don't want to get hyper technical, but the administration needs to sign off on our rules, and then the legislature needs to sign off on our rules. The legislature needs to pass a fee bill for us. The governor needs to sign it. And then, you know, all those things can happen within the time frame, but it's going to take kind of a lot of people pulling in the same direction when there are a lot of competing priorities this year. That being said, we do have some strategies to speed up the process. One is we've decided to have provisional licensing. So let's just say a retailer, you know, has maybe a place picked out, you know, he's got some partners together and a business plan. That person can apply for a provisional retail license early on in the process. We will do our background checks, make sure that there's no kind of disqualifying criteria that would push us to you know, disqualify this person from having a retail location. And then that provisional license will allow that person to sign a lease, to secure financing, to get all of the ducks in a row so that on October 1st, he or she can convert their license into a full license and open doors. So we're trying to bake in a few steps that will allow us, one, to gauge the kind of entrepreneurial demand, both on the cultivation side and the testing and product manufacturing and retail side, but also give people kind of a head start that they'll know that they'll have some confidence that if they can kind of get one of these provisional licenses, that they'll be able to convert it to a full license at the appropriate time.
Well, this has been a very informative discussion about a very important issue in Vermont. Many thanks to our guests tonight, Representative Maxine Grad, Dr. Mark Levine, and Cannabis Control Board Chairman James Pepper. Thank you all very much for taking the time to be with us tonight. We really appreciate it.
Thank you.
Thank you.
Thanks for the opportunity.
This conversation will be archived on the Vermont PBS YouTube page. And stay tuned to VPR for continuing coverage of the legalization of cannabis in Vermont. I'm Bob Kinzel. Thanks for joining us. Be safe and most importantly, be kind.